I witnessed, recorded, and produced these videotapes of the Washington, D.C. hearing. Their authenticity is above question.
This is produced as part of the ongoing work on the website, thewaythetruthandthelife.net.
This is a hearing about the government licensing the electrocution of people to cause grand mal seizures. Think of the millions of dollars, taxpayers' money, spent to pay psychiatrists and their supporters and for the worldwide travel in putting this conference together, while the victims and opponents had to pay their own way.
Are there any other comments? Yes, Dr. Breggin.
In regard to what Dr. Sackman said, what you're saying in your report is more consistent with conventional wisdom in psychiatry, and I think that one or two studies out of several thousands should change the conventional wisdom, even though I would rather not even see the conventional wisdom that's so highly promoted. I think there's a basic consistency between using terms like most convincingly to describe the effect of the treatment, when in the earlier paragraph you have so clearly noted that the effect doesn't last beyond 4 weeks, as far as we know. I think that your analytic description is more accurate than your concluding evaluation. I would like to see inserted that those 4 weeks are the weeks of delirium. That is, that the only studies that show any effect in ECT, this is critical, the only studies that show any effect in ECT show an effect during the period of delirium. And if you were measuring any higher emotional response, not just depression, but the ability to love, the ability to have a religious experience, the ability to work, the ability to take care of your children adequately during that 4-week period, they would all be reduced, not just depression, so that there is a misemphasis here in the statement. In fact, during those 4 weeks, the patients were often incompetent.
They don't want to respond to that yet.
Well, we have said in our report that there have not been any studies which have used outcome measures of quality of life and social functioning, and we urge that those are the types of studies that should be done. We've emphasized that the outcome during the 4 weeks is reduction of symptoms, which seems to be documented in those studies. The reason that there's no data beyond 4 weeks is that studies are only done for 4 weeks, and after 4 weeks, the patients in both treatment groups have gotten other treatments, and therefore it's not possible to evaluate.
One electroshock treatment can equal the energy of 3 pistol shots to the head.
Dr. Rose accepted 2 pieces of literature for reference. I would hope and you might make copies available for the panel. We're talking about having at least accurate information on the device and what we're using. And the one copy is the Thymatron, the brochure on a single sheet handout on the Thymatron pulse ECT device. And in there it shows the physical characteristics. The other, and pardon me for the emotional content of it, I've also included a current Winchester ammunition catalog because it shows the energy with which the bullets have. Now that's emotional. I don't really want to bring that up. But running this machine at its maximum brings 201 joules of energy. That is 148 foot-pounds. If you're interested in actually understanding like the truth and length and what they're talking about, 1 joule is 0.07376 foot-pounds. But what this means is this device, when operated at its maximum capacity, will lift a 1-pound weight 148.7 feet. The energy contained in that is equivalent to 3 25 caliber pistol slugs. Now that's almost instantaneous entering the brain. This takes a half a second. Now that is just pure factual data. give that lifting of 1 pound energy equivalents in informed consent. How could you not do that? And if you're going to give a procedure, the total energy and the total time are the physical parameters that characterize the device. How could you not include that information? And if a doctor prescribes a drug, he has to record the prescription. Why isn't the total time and the total energy recorded? This has been an experimental hazardous device for years now. Why hasn't this information been gathered that we could be talking with concrete objective facts rather than subjective opinions of psychiatrists and patients?
One electroshock treatment can equal the energy of 3 pistol shots to the head.
All right, out with your gun. Out with your gun.
Okay, this won't hurt. It'll be over in just a moment.
What's that?
Conductant.
Oh, that will do you. Right, Mr. Jackson.
Open your mouth.
What's that?
This will keep you from biting your tongue.
Well,
Now just bite down on it. That's right. Just bite down. Now bite down on it.
good. Are you ready? Here we go.